Understanding disenfranchised grief. Disenfranchised grief is a form of grief that occurs when grief isn't openly acknowledged or validated by society. It's experienced when a person's loss isn't publicly recognized or is considered less significant by others. This can happen in many different kinds of situations. For instance, grieving the loss of an ex-partner or a partner who may be unacknowledged, such as a partner outside of a marriage. Or when the loss of an unborn child is not perceived as a significant loss, such as when a woman has a miscarriage. It can also occur when someone experiences infertility, or even when a woman undergoes an elective abortion. Stigmatizing deaths can also result in disenfranchised grief, as grievers may not be able to openly speak about their loss with others. For instance, when death occurs from causes such as addiction, drug overdose, murder, or suicide. People can also experience disenfranchised grief when their loss is minimized by others, like when a person loses a pet. And some workplace cultures also make it harder for people to express their grief openly, such as many healthcare workers feel unable to openly express their grief for the loss of their patients. Even non-death losses can lead to disenfranchised grief, as people may be made to feel that their loss is less valid. Yet such losses can be exceptionally painful as well, such as the loss of a job or a relationship, or that of a significant life role. Grief that remains unacknowledged or hidden makes it much harder for people to seek or receive timely supports. But grief does not have to be disenfranchising, and people shouldn't have to hide their grief. We can empower people by offering them our empathy, compassion, and non-judgmental listening. After all, grief is a common human experience, and we can all be in this together for each other and with each other.